Hello and welcome to this episode of In Discussion With from Medical Update Online. Today I'm talking to Kläre Bryant about clinical pharmacy practice in dermatology. Kläre, could you start by introducing yourself?
I'm Kläre Bryant. I'm the advanced clinical pharmacist in dermatology, and I do that at for Liverpool University Hospitals NHS Foundation Trust. And I'm the dermatology pharmacist for the trust. I'm based at Broad Green Hospital as a day-to-day as a pharmacist, and I also run outpatient clinics, one at Broad Green Hospital for biologics patients and one at Aintree Hospital for systemic DMARD patients.
What elements does your job as a dermatology specialist pharmacist involve?
An extended part of my role is to run my own clinics. So one of which is for biologics patients. So I do biologic monitoring for patients who are on, I actually do monitor the infliximab cohort, and also I do monitoring for patients who are on systemic medications, DMARD such as methotrexate, azathioprine, and any other DMARDs. Having a skin condition is something that can take over people's lives. It's a very visible condition to have as a problem with your skin, whether that be something that's affecting your face, your hands, your feet. It's very visible having something on your face or your scalp where your hair might be falling out, where the scale coming from your scalp, hands, dealing with day-to-day, paying for things in shops, or just trying to write. You might have a problem with your nails, walking on your feet if there's something that it's painful to walk because you've got a skin condition on the bottom of your feet. Just simply wearing clothes, exercising, running, clothes rubbing on your body, and also patients going for surgery as well. That might impact their having a hip replacement or a knee replacement, or a abdominal surgery or anything like that, where the patient's skin has to be clear to be able to have that surgery. So it's so important for treating the skin and ensuring that patients are comfortable, less self-conscious of their skin and themselves, and it just impacts people's confidence. So it's just so important and shouldn't never be underestimated. With patients who have real skin conditions, and we should do everything we can to support them, get the best out of their medicines so that they can achieve the very best skin that they can.
And what would you say that pharmacists can bring to the management of people with skin diseases?
It's just so important to help patients with their skin, get the most out of their medicines, and understand why they need to use the creams that they have got, and help them really get into a better regime of when to use the creams, and so it's got less impact on their day-to-day life, because a lot of these things can be messy and smelly. So we, and they can get on people's clothing, get on their bedding. So we want to help provide lots of advice to patients just with when to use these creams and how to use them, so it's got minimal impact on their life but maximal impact on their skin control.
Now that you've set the scene, I'd like to get into a little bit more detail, and my first question is, how did you get started as a dermatology pharmacist?
It was just a progression of my experience and my role. After doing my pre-registration pharmacist, being a pre-registration pharmacist, when I qualified, I moved over to an acute trust, and I then completed my diploma, clinical diploma, and then moved to the paediatric hospital for 4 years, and then I moved on to where I am now, where I've been for 9 years, and specialised as a dermatology pharmacist.
And what was it that made you interested in dermatology as a pharmacist?
I think I've always been interested in dermatology, and seeing in my other roles in the other hospitals, seeing dermatology prescriptions come through the dispensary and checking those, and always had an interest in dermatology and what's going on the skin. And it was just probably by chance, coincidence, that I then saw the position of the dermatology specialist pharmacist had been advertised. So I was, I moved from that from another hospital, from a paediatric hospital, to this hospital, having seen the position advertised, and I was really interested in it. So decided to go and have a look and see what was going on. And it was really interesting. So I decided to go off and apply for it.